Thank you. Sorry, did everyone hear me or shall I repeat that? Yeah, I'll repeat it. So welcome everybody to tonight's overview and scrutiny meeting. I'll just go through the housekeeping first. It's a hybrid meeting. It will therefore take place over Microsoft Teams and it will be broadcast on YouTube. Those attending virtually will not have their attendance officially recorded as present in the minutes. However, their virtual attendance will be noted in the item on apologies for absence and substitutions. Any members attending virtually will be able to speak, but not be able to vote. So I'll move to item 1, apologies for absence and substitutions. Would you like to do that, Sam?
Yeah, as you can see, we've got Councillor Haley present virtually, and we've had apologies for lateness from Councillor Praveen Anand. Yeah.
Thank you, Sam. So item 2 is, are there any declarations of interest? Nope. There are no matters to be considered in private. Can we move to item 4, the minutes of the meeting? What was the date? The
3rd of July.
On the 3rd of July. Can we agree those as a correct set of minutes? Thank you. So we'll move to item 5 now, which is the local government funding reform. And Emily Hill will introduce this, our Strategic Director of Resources. Hand over to you, Emily. Thank you.
Thank you, Chair. Good evening, members. And apologies, I think we'd hoped at this stage in the year we might be able to bring you a little bit more certainty and a little bit more information on our funding allocations. We're probably about a week or two too early, so we're expecting a local government policy statement mid-November where we will be able to hopefully assess better our level of funding allocations that we will need for the 2026-27 budget, so the budget that you will review in the new year. So at the moment we're really able to talk to you only about principles and probably explain at a very high level about what you might see in the new year looking quite different to what it does now and what you've seen in previous years. So at least we'll have done some of the work in trying to set you up for that as you take the budget in the new year. So I'll take you through probably just some of the key sections of the report. I guess the key point really starting in terms of funding reform objectives and principles is that sort of last December, the government started its consultation on funding reform. Local government funding's quite has been very complex. The formula that we use today was first put in place in 2013-14. So actually, when you think about that, that does seem a lifetime ago. If you think, you know, sometimes how different things feel since COVID, which was 2020, we're talking about a good six years before then. So actually, we are looking at a funding model currently that is outdated and very much in need of review and updating. So in December, the government consulted on some high-level principles. It also promised a multi-year settlement because we've had single-year settlements for a good number of years now. And it also, through that consultation, sought to simplify some of the funding available to local government. The key elements of the change in the new funding formula are set out in paragraph 5. So I guess it's important to understand here that this funding reform is talking about a local authority's relative position in relation to other local authorities. So what this formula does is sets out how a total funding envelope will be shared between different local authorities. So the first element is a relative needs formula. So that looks at how each local authority might have different levels of demand. So, for example, its children and young people population, its population of under 18-year-olds or children will affect the levels of children's social care that it will need to provide. So the relative needs formula is something which is trying to identify need, identify what's going to drive the costs that local authorities will have in providing services to its residents. That's then adjusted by an area cost adjustment. And we're all used to sort of thinking about how London costs are much higher, for example, because of housing, other workforce costs and other things. So a sort of London weighting, but the area cost adjustment is sort of much broader than that to account for different differences in the costs of different localities and providing services. And then finally, after understanding that sort of level of need, there's an adjustment within the formula to say, well, how much is the local authorities able to raise in terms of income for themselves? So how much council tax can they raise? Because after we take into account the money that the local authority can raise, we then know how much grant is required to meet that level of need. So the methodology was set out back in December in terms of those key principles, and then, as we see later, more detail has been provided on those three elements. So set out some principles of funding reform, and then it's looked to introduce those as it's gone into more detail. So an initial consultation in December that was then followed up by 2 more significant consultations later on. So one of the big elements of this funding reform, and one of the big changes that we will see in our funding for 26-27, is what's called the business rates reset. So currently, the business rates retention system was introduced to incentivise councils to encourage and enable business rates growth within their boroughs. And funding was set on what was called a baseline funding level, and on a business rates baseline, a baseline that the current each local authority would be able to collect through its business rates. And then once that baseline was set, any new business rates and new business rates growth by that local authority, that income from those business rates would be able to be kept by that local authority. So in doing that, what that did was it changed the funding available to a local authority based on need, which was the baseline funding level, to need plus whatever it could grow. Now that business rates reset was meant to happen every 4 years. So essentially every 3 or 4 years, what should have happened is the excess funding went back into a pot and then got distributed by need. Because that business rates reset hasn't happened, essentially there are a lot of local authorities, or there are a number of local authorities who've had significant business rates growth over now 12 years, who have kept additional income that otherwise would have been redistributed based on need. So, and we see later on in the report, there's some local authorities who stand to lose quite significant amounts through this funding reform. Places like Westminster, places like Kensington and Chelsea, places like the City of London, where their business rates have increased significantly, and yet their need perhaps certainly hasn't increased at that same rate, and perhaps their need relative to others has decreased because their populations haven't grown to the same extent, and their levels of deprivation have probably reduced, whereas others perhaps have increased. So the business rates reset, what that's doing is it's saying all of that growth that went in, that local authorities have fortuitously, although also potentially worked towards, has made the funding move away from need. All of that funding now goes back into a central pot and will be distributed based on need. So that's quite a redistribution of funding. Apologies, I thought I put that on silent. Okay, so business rates reset. So in terms of our position, I talked about some central London authorities which have had significant growth and therefore stand to lose that growth as it goes back into a central pot. Ealing has had modest growth in its business rates over those large number of years, about £4 million. So there is a risk, of course, that we lose that, but actually what that does is it goes into a pot and becomes redistributed back based on need. We don't know yet exactly, but our feeling and our understanding of how that redistribution might occur would be that we'd likely get more back based on need than that growth that we've had. And I'll come to that a little more as we go into the funding formula. So we don't think business rates reset is a significant risk to us. And in fact, we think, that sort of accumulation of funding over those last 12 years will provide us with an opportunity, because more money is going back into the pot to be redistributed back out again. The business rate system is very complicated with series of other adjustments like top-ups and tariffs. And if you had any questions on that, I would try to answer them. But to try to understand the fundamentals of what's going to happen in relation to that, I think that's probably at high level enough for you to sort of understand where the risks and the opportunities lie. So the business rates reset will help put money back into a pot, and fair funding formula will now decide how that pot is going to be distributed. So the consultation on that started in June and closed in August, and goes back to those key areas that I talked about in the initial review. Some additional points which I think are interesting is as in paragraph 17, and talks about how the grants will be distributed. We are going to see the revenue support grant, which is the general grant that local government gives. We're going to see a consolidation of homelessness and rough sleeping grants, because they're currently distribute a number of different grants, and we're going to see a continuation of public health and the public health ring fence. So there is no indication that the public health grant will now be merged into the general grant. And this new grant, called Crisis and Resilience, will replace what's currently the Household Support Fund. So that's the fund that's been used to sort of pay for free school meals in school holidays and other grants to people in financial crisis. So Crisis and Resilience, we don't know very much yet. We understand that the consultation and the guidance on that's going to come out in January, but at a high level, what that will do is replace the current House Support Fund. Just, I guess, figure 1 sort of shows you, I guess, how sort of funding has changed over the years. So we would have started with the business rates baseline and the revenue support grant, and over the years we've got different grants coming in as the government has reviewed different requirements, has understood different pressures. So we've had the better care funding for adult social care, we've had social care grant, we've had the new homes bonus, we've had other things like national insurance compensation and recovery grant. All of those grants now are going to be consolidated into one overall pot and one overall grant. So the new revenue support grant will take all of those different grants, put them all in one pot together. It will, bless you, it will take the growth from the business rates, and it will take some of the housing prevention grant, temporary accommodation, to put it into a single pot. So that's going to be much clearer for everyone to understand in terms of the funding that's coming in from government. So we talked about that sort of relative needs formula and how the formula will look at what influences demand for services. So I'm on paragraph 21 now. And that relative needs formula has said there are some areas that local authorities undertake work where we need a very specific formula to understand the money that we need to deliver the services. There are other areas that we will just pool all together to say this is how we will create local government funding. So there is very specific, and rightly so, given the amounts of money that we spend on them, very specific formula for adult social care, children's social care, highways, home to school transport, temporary accommodation, and then the foundation formula will pick up all the other services that we do. So there are different formulas there to try to understand the different drivers of cost. So adult social care very much will take into account population and deprivation. The same with children's, it will look at very specific children's population numbers, again, and deprivation. highways will look at sort of the length of our roads that we're responsible for. And a new one very specifically is temporary accommodation, and that should benefit London boroughs because of the sort of extent of homelessness and temporary accommodation costs that we have. So that's useful. The foundation formula sort of largely picks up population and deprivation. So I think I've got a bit of news hot off the press, or not so hot off the press. As we said in 26, some of these formulas are based on measures of deprivation. The council plus other councils in London had significant concerns over the way that deprivation statistics were used. So previously, those deprivation statistics didn't take into account the costs of housing. And we know in London that housing is such a significant cost to our residents, and therefore to the income available to our residents, that it's a big driver of sort of deprivation or poverty, essentially. Feedback on that has meant that actually just last Thursday, the new IMD, so that's the Index of Multiple Deprivation, was published, and those deprivation statistics now include housing costs. So we had said here that we had concerns around the measures of deprivation being used in the formula. Those measures of deprivation do now take into account housing costs, so that should be of benefit to London, probably quite widely, and certainly to Ealing. So that was just last week, and explains, I think, very, very sort of clearly how we just are, as information is being published, we're getting closer and closer to understanding, but things are changing sort of every day. I think I probably already explained that area cost adjustment, and that's that costs would be higher or lower depending on sort of the location of where you are. One of the things that we and other London councils had concerns about was there was in the consultation an element of cost sort of factored for remoteness. So a kind of suggestion that if rural areas were much more geographically dispersed, that there would be additional costs potentially of travel to do that. I think whilst there are sort of factors and evidence in terms of London costs being higher, there was no evidence, or there was no evidence presented, at least at the time, to show that that remoteness was an evidence-based adjustment. So we're yet to see whether in the final formula they're going to include that remoteness. Obviously, being London, remoteness factor isn't going to help us. We're very urban and not remote at all. And then the final adjustment, as I said, was in relation to our ability to raise council tax. This is where this doesn't help Ealing. The adjustment, the resources adjustment, will estimate the amount of income that councils will be able to obtain from council tax. What it doesn't do is use the actual levels of council tax that councils use, but it will use a nominal rate, what they're sort of counting an average rate. So that's £2,000. Obviously, Ealing's bandit is less than that. And what the government will do is it will assume that we can get £2,000 from every house from Bandy. We can't do that. So it's reducing our grant by more than we are able to generate through council tax. So that is a concern for us. The other concern also is it will take an average expected reduction for council tax support schemes. You'll know that the decisions here and the decisions of the administration here have put in place a generous working age council tax support scheme, and the government will assume a sort of average, which again means that it will expect that we can generate more income than we can. So that resources adjustment isn't currently helpful. And again, across London, council tax is lower across London than a lot of the country, and particularly in, I think we have the 3 lowest council tax rates in the country within London, and that will severely impact on those boroughs. I talked about severe impacts. There are some quite severe changes potentially for some authorities, and there is an intention that there are transitional protections. So there will be a sort of 3-year sort of merge. So no one will have the total loss in the first year, and it's expected essentially that they will have to meet the total loss over the next 3 years. There is a floor, only that there are some London boroughs, some councils, but particularly I think some inner London boroughs, where that floor won't be applied. So there are a number of inner London boroughs particularly who are expected to lose more than the floor that's in place. As I said, our current understanding, based on the current consultation, of both the impact of the relative needs formula and the business rates, is that Ealing is unlikely to be a significant winner or a loser. So we look to be in a relatively neutral position. I think that indices of multiple deprivation announcement last week might mean that we're more a winner, sort of, but I don't think we're sort of significantly going to have significant amounts of funding changes. But clearly we'll work that through and we'll bring that back to you as and when we know more. So that's the formula. I guess the last thing to say is if the formula tells us about our slice of the pie, our share of the pie, then the spending review and the budget tells us about the size. The spending review in June did say that local government funding would increase by 3.4 billion over 3 years, which is a good thing. That's funding over and above inflation. What's not clear at the moment is how that 3.4 billion is profiled in, whether we get it all at the beginning or whether it's sort of phased in over the 3 years. And what's also not clear is how that additional funding will be distributed. So we're not clear whether it will go into the overall pot to be allocated out based on need, or whether some of that additional funding will be used to meet the funding floor. So those that are impacted by the funding floor need extra money, then their formula would say whether the extra money will first be used and allocated into there. So at the moment, we don't know. I think there's also a question, given we know we have an autumn budget about 3 weeks away, we don't know whether there will be any further changes to the spending review or the amounts available to local government during that meeting, because clearly the chance of taking a wider view of the UK public finances. I think I've covered the next section, is the impact on individual councils. We don't yet know exactly, but we know that the principles of this reform do mean that it's going to hit some inner London boroughs pretty hard, although possibly less hard since last week's announcement. We will continue to review. We're waiting for the policy statement, and we will obviously explain the changes to the committee as it takes the budget report. So I'm sorry I haven't been able to tell you more now. I had expected to, but hopefully you get a flavour of where the risks and the opportunities are. I guess just as sort of an aside, because I couldn't not put it in for you before you consider the budget, is that the council continues to experience significant pressures in relation to those demand-led services, children's, adults and temporary accommodation. So the Q2 report has been published now. Within sort of services, we are seeing overspend in demand-led services of over 11 million. We currently do have corporate budgets and contingencies that are offsetting that, and we're managing to report a balanced budget and a small overspend. But those underlying pressures in children's, adults and homelessness will need to be addressed as part of next year's budget.
Thank you very much, Emily. It was a very good report and very well explained. We also have our Cabinet member, Councillor Steve Donnelly, with us tonight. I would like to give you the opportunity to speak now, Steve, if you'd like.
Yeah, looking forward to the discussion. Thank you, Chair. Just want to make a couple of points in terms of political context, because I think anybody who's been around as long as I have knows that you get these generational adjustments in the ways in which funding is found for all sorts of institutions in society, of which local government is one. And I think it'd also be fair to say over the generations that governments haven't always rushed to make the adjustments and changes as speedily as local government, for example, would have wished it to do. So in a sense, this is something we've seen before, but in another sense, I think it's more urgent than it's been at other times, partly because I think what the previous settlement I see is you had a triangle of central government revenue grant, council tax, business rates, and that created a balance. And within revenue grant, you had predecessors of index of deprivation. Those of us who remember the standard spending assessments, where government identified what a council should be spending on social care and the like, and sought to have a kind of matched funding arrangement with councils in terms of how it managed council tax. But I think what we saw through after 2010, through the coalition and Conservative governments that operated until 2024, there was, I don't think it's controversial to say, there was a unilateral pushing down of the role of the revenue support grant, and therefore the shape of the triangle changed. But council tax and business rates in most places were not in a position to rise to balance that out, and particularly, I think Emily referred to it, there are places around the country, places like Blackpool are commonly named, which are very high council tax, but really a very small base of homes that generate significant council tax revenue. So they can't make up for loss of revenue support grant through their local activities, whether it's business rates or otherwise. And then, of course, the plan, which not an unreasonable plan around the reform of business rates, wasn't then executed, which has led, I think, a number of councils to come to the view that it never would be executed, and that everybody would be able to keep all of the money all of the time. But I think returning to this principle that in effect we have, it's if you can push up your business rates, it's revenue, but it's unconsolidated revenue. It's yours for the year, but it's not going to go on your base, you know. And I think it's a reasonable way for government to seek to find a source of money to redistribute. Now, we're not going to resolve that imbalance that was created by the reduction in the revenue support grant overnight. But I think what you see in terms of the refocus, which is taking a kind of local government, in local government terms, a generation's worth of impromptu pots for specific purposes being corralled together, put back together into the revenue support grant to simplify the system. We know this happens around local government all the time. You get consolidation of money, and then specific things appear for particular urgency purposes. So I think, you know, it's impossible without an infinite source of additional funds to make a rebalancing exercise like this without a certain amount of pain in some places. But I think from what we've seen, and as Emily said, we don't yet have the picture. I think the principles upon which it's being constructed, I think the transitional arrangements that are being flagged, and the adjustments that have already been made in response to the consultation exercise, give me confidence that in the context of a 3-year settlement, the 3-year settlement approach that we're going to have moving forward, that councils like ours are going to have the flexibility to make decisions to improve our circumstances of residents better than we have been able to do up to this point. And I've sought to minimise political point scoring as much as possible. And if I failed, I can only apologise.
Thank you, Steve. I think it's a very promising start, but we know we're not out of the woods yet. So I'm opening it up now for members of the committee to ask questions. I think I had Councillor Ball and then Councillor West and Councillor Anand.
Yeah, so first thing, a bit general, how confident are we that the new formulae will accurately capture the specific issues that Ealing has? You know, things like you've mentioned high housing costs in terms of children and young people. More broadly, does it capture those other elements and other factors we've got, like having pockets of deprivation at a very local level, whereas other bits are more affluent? So yeah, is it capturing our specific things? And then the other thing is, in terms of the reset, do we have any idea whether it will now reset every year, every 3 years, or is it again? Might it just go on for another decade again before they reset it?
Thank you. So yeah, the funding formula are very complex. I think we do still have concerns over some of the children's formula and the way. So even I can. Let me answer the next bit first. So I think in terms of sort of specific elements, I think quite a lot of our elements are sort of shared by London, or certainly outer London boroughs. The point you make specifically, you're quite right in relation to deprivation, because the IMD, those indices of multiple deprivation, are based on that lowest output area level. I can't remember, LSOAs they're called. I can't remember exactly what that stands for. And what happens then in the index is that they get averaged up. So it will take into account our sort of higher levels of deprivation and our lowest levels of deprivation. So insofar as, you know, you couldn't expect to have an allocation on a sort of ward or LSO basis, it is taking into account that variation in deprivation within our communities. So I mean, I think at the moment, apart from sort of some concerns over children and the impact of housing there, because the IMDs now do take into account housing, I think in general, those consultations and those formulas are reflecting the levels of demand and need that our populations present. We've picked it up already, but clearly we're not clear that the remoteness factor, that certainly won't help us, but we don't think that's evidence-based at all. So that remains a concern. As to the reset, absolutely, there is an expectation that there will still be an incentive for local authorities to seek to enable and support business growth, but that is meant to be on a time-limited basis. They are actually consulting on the period of reset, but the expectation is it will be sort of between 3 to 5 years, I think. So we're not expecting another sort of 12-year run. And, you know, the more I think about and look at it, the world has changed quite significantly in those 12 years to sort of think that need wouldn't have grown or kept aligned with that business rates growth during that time. So yes, an expectation of reset on a much more frequent basis, and government are still consulting and deciding on the period, but certainly not 12 to 13 years.
Come back with the supplementary,
Yeah,
Councillor.
just very briefly on the deprivation point. I mean, I guess it seems likely that if you have an area like Ealing, which has extreme deprivation in parts in some of the lower super output areas, and, you know, quite wealthy other bits, then the additional service need from the lower ones would be greater than somewhere that has the same average but with less difference. I mean, that's the point I was making. I don't know. So I guess that's not captured if it's averaged out, I suppose.
Yeah, I think you are right. I think that there is a balance, and as we see in those principles, they sort of talk about simplicity as well, so that people could understand. So you're right, there is a balance between that accuracy and a simplicity there. I would tend to agree with you that sort of higher levels of deprivation are likely to drive more costs than a sort of average level of deprivation across the piece.
Councillor Wesson.
Thanks very much. Thanks, Emily, for a really clear presentation. Just a couple of points. So in relation to the ring fencing of the public health grant, have we got any clarity around whether there'll be kind of conditions attached? Because previously, when we had service-specific grants for things like drug and alcohol services, smoking services, there were clear kind of expectations around some of that funding. So it'd be really helpful to understand if we have more flexibility now on a local level to determine our priorities. And then the other thing that I've been reading about recently was about the greater local control over the soft drinks levy, and there was a push, I think, from the LGA specifically to look at whether local authorities could benefit from that for tackling things like health inequalities, higher levels of obesity, tooth decay, those sorts of things. And just wondering if we've had any insight on that either.
Thank you. In terms of the public health, you're quite right. There have been specific additional grants sort of added into the public health, including on drug and alcohol, as you've mentioned, which have sort of been ring-fenced for a particular activity. Our understanding actually is that is likely to continue. So they haven't really reduced the ring fencing in the public health grant. I mean, the vast majority of the public health grant is ring fenced to public health, but we are able to choose sort of locally the priorities. I mean, there are clearly very specific public health contracts that we must deliver and services we must deliver. But other than that, there remains that. But actually, for those very specific areas that you mentioned and the additional grants, my understanding is that's likely to continue. They are very specific priorities, which they want to keep that kind of conditions. It may well be, as you say, that they're not allocated as separate grants anymore, but the terms and the conditions of the grant will sort of pinpoint an allocation of that amount. So I don't think that brings us more flexibility. What it does do, we believe, is that we will get the allocation at the same time as the budget, which we've never and I understand they're also looking to give us a medium-term allocation, so a more than 1 year settlement. So that will also help. But no, I don't believe it will give us any more freedom than we currently have. The soft drinks levy, we haven't sort of modelled. London hasn't really modelled it. I guess it's really difficult to do. The other sort of area that sort of London would lobby for is a sort of that tourism tax and other levies like that. But at the moment, very difficult to model and would require sort of changes. So, but you're absolutely right. You would think that sort of soft drinks levy is so linked to health inequalities that actually that kind of funding you would want to go into public health activities in local authorities.
Thank you. Councillor Anand.
Thank you, Emily. Very nice presentation. Councillor Ball actually covered a few of my concerns there. So I'm going to try and rephrase the question to another question that I had. So with regards to when we have the RNF, the drivers, how do we assess the needs for, in paragraph, I think 22, it was about home to school needs and also the changes in temporary accommodation, because the needs, obviously with the immigration changes and also our housing target changes, the needs will change quite dramatically as opposed to the requirements, as opposed to it may if we don't review it. So although my question originally was how often will we review it, it's more now I've rephrased it to the temporary accommodation and more clarification towards home to school. And what does that cover? And just a general note on the glossary of the termination, the terms used, is the general foundation formula and the foundation formula one of the same? Because somewhere on term one and somewhere else. So that's it. Just a little bit clarification. I tried to rephrase my question so I don't repeat things. Thank you.
Thank you. Yeah, I think what you've picked up is a really good example of why these funding formulas do need to be reviewed and assessed on a regular basis. You know, 3 years ago, we didn't have the temporary accommodation pressures that we do now, and such a significant driver of our demand and our costs. So there is an expectation that whilst they might not particularly change the formula each year, they're looking to actually reassess the data, so sort of the impact for individual authorities. So they still haven't sort of confirmed the sort of timescales, how much they'll update and when, but there is an expectation that whilst the formula might stand, actually the underlying data that informs the allocations will change. I mean, there is a commitment, of course, to a multi-year settlement. So we'd expect some stability within that multi-year sort of 3-year settlement, but then a sort of review of that data, and that temporary accommodation is that perfect example, really. In terms of the home to school transport, that's probably less of an issue for Ealing than it is for some of the counties, for example, where children may have to travel long distances to get to school, and then there's the sort of buses and other things. We have slightly different arrangement in London because of TfL and because children and young people sort of in an urban area aren't remote and can quite easily take themselves to school. So there's lots of elements of that formula in terms of sort of the population of children and young people, sort of the sort of area and geographical spread and things like that that will influence the funding in that one. That one doesn't particularly help us. I mean, it will help us understand the demand and need in that area, but the new temporary accommodation formula certainly will. And so apologies, the glossary isn't very good if it uses different terms in its glossary to what I've been using in the report. They are one and the same, the foundation formula.
Thanks, Emily. Of Councillor Moffat next.
Thank you very much, Chair. And of course, thank you very much, Emily, for a fantastic presentation. In my scrutiny panel, we looked at the work the council is doing to reduce pressure on demand-led services. Is there a kind of perverse de-incentivisation in this or on that work, or does this still really encourage us to do that kind of reducing pressure on demand-led services? Thanks.
I think it's absolutely an incentive to do that, because these formulas were based on sort of wider population characteristics. It doesn't necessarily rely very specifically sort of on the current sort of populations or cohorts that we have, but wider populations in actually we might be if we have for example, we have a very low proportion of looked after children in Ealing, but the sort of formula will be based on the wider children and young people's population rather than the amounts we very specifically have. So if we manage to reduce and manage demand, we will be getting funding for an average council and average demand, subject to deprivation, subject to all of the other elements of the formula. So no, so it should provide that sort of incentive to continue to do that good work, in also because there's better outcomes for the people that we're supporting, isn't it? So yeah, my understanding is that there isn't any sort of disincentive or unintended consequences of the way the formula is driven to how we might say, well, okay, we'll just bring more people into residential homes when we know that's the wrong thing to do.
Thank you. Councillor Rice next, please.
Thank you, Chair, and thank you, Emily. Because this is actually making me think a lot about how prescriptive the central government can be in terms of dictating, as it were, how we spend our money and where we put our money on. So I'm just quite interested in the fact that if we are kind of simplifying it, which is really good, which is really great for like our flexibility and be able to meet the needs that we have. What I'm just thinking about is how likely is it that thinking about unintended consequences, that we might end up with a situation where that there'll be money which was previously going to homelessness and money going towards temporary accommodation, that someone might decide, oh, we're going to put more money into temporary accommodation because it might look good on the figures, but then maybe neglect homelessness. This is just an example. And if that kind of situation happens, how alert is central government going to be in terms of ensuring that we are fulfilling our obligations, and and maybe and maybe looking after those homeless people in this example who may be being neglected in the meantime? Thank you.
Thank you. So yes, as you say, the simplification does help because it allows for local prioritisation of funding. I guess whilst it does help, and it helps from a sort of administrative point of view as well, because there's a lot that goes behind a lot of these grants. You have to report in as to how you've met conditions and everything. So it's definitely a good thing. I guess whilst local administrations will make significant priority decisions and budget decisions, the discussion that we've already had and we've had here many times around the nature of demand-led services and the statutory duties we have to provide those. Actually, we spend over 3/4 of our service spend on adults, children's and homelessness and temporary accommodation. So in fact, the level of local prioritisation can be quite limited. And so I don't think that the government will pick sort of up those kinds of changes in priorities or local deprioritisation or prioritisation through the funding. They would have to do that through their other monitoring mechanisms and targets and reports that they set otherwise. So you're right to an extent that they are relinquishing some control by changing those grants and the level of funding, particularly in adult social care. But my understanding, particularly with the adult social care, is particularly because the money is also provided by the Department of Health, not only MHCLG, is they are still going to require some reporting requirements on adult social care. So not necessarily the area that you picked up in terms of temporary and homelessness, but certainly in adult social care, they still intend to require us to report on what we're doing.
Thank you. Councillor Conti.
Thank you. That was really interesting report. I guess obviously it's good to try, obviously, the simplification of the system, etc. But by the sounds of it, obviously you mentioned about a neutral position. That actually the fundamentals for Ealing Council won't really change in terms of the amount of money that we're getting. We're not expecting it to be significantly more or less than we've been getting. So I think as it touched at the end of the report about the ongoing pressures, I guess a bit more about what a 3-year assessment would mean in terms of trying to produce, in terms of trying to find those savings and those transformation plans, and what would be done differently than what's being done already, given that sort of 3-year sort of outlook that you've got in terms of money that's come down the track. And I guess in terms of, do we think residents will see a difference in terms of, because obviously, people's experience of the council often, as you just touched on, 75% of council services, council spend is on those statutory services, and that very small proportion is probably what the vast majority of residents see as day to day. Do we think, given a 3-year settlement, that there will be any room, or that residents in 3 years' time will say, actually, as a result of the changes and the flexibility that we've just spoken about, that some of those other areas of the council that maybe have become not victim is the wrong word, but have suffered as a result of the way that the spending's gone, will they see an increase in funding? Do we think that they will, that residents will notice a difference in some of those other services?
I think that's really difficult to answer, but I'll try and answer what I think it should do. So I think in terms of having an annual settlement, we really haven't known from 1 year to the next whether we may have significant funding cuts that we would need to address through potentially quite significant sort of savings programs one year to the next. We know, and as Councillor Moffat talked about, the best thing to do and the cheapest thing to do is to prevent people in the demand-led services coming to the council. Of course, prevention is really difficult because it requires you to put money in to prevent new activity coming in at the same time as you already having to deal with the activity that's there. So prevention requires some kind of double funding whilst you're still dealing with the activity. I think whilst we had 1 year settlements, we never knew if there was the ability to invest in something, to see it through for 3 years, to expect something to come back out, because we just didn't know what we were going to have the following year. We may have had to use reserves to balance a budget or to do other things. I think the 3 year lets us say, okay, we know for this period, because, and to be fair, 3 years isn't long to have results through prevention, but it's better than one. We will know that we can say, okay, we think we can make differences in this if we were to invest in some of these things early on. And we can do that because we know we've got a stable income base going forwards, and we know we're not going to have to save this money in case something happens there. So I think it doesn't allow you to take a longer term view on which would mean that you would invest in things, hopefully, that has preventative impact. And I think will residents see the difference? I think if that prevention is successful, then the costs of those statutory services reduce, which now allow potentially more ability for local councils to prioritise the things important to their residents. Because, as you say, actually a very small minority of our residents experience that 75% of our spend, and the other areas, really that 25% less, are those universal services that people do see. So I think there's a lot of work to get there. I think it will require, I guess, some quite brave decisions to make investments in prevention early on in a 3 year, and a kind of faith and a monitoring that ensures that if you do put investment in, it's going to reduce expenditure in that medium term. And it will only be sort of as we deliver that there will be more choices over local spending. There's a lot of work to do, and that won't be easy, because whilst we're looking for prevention, we're seeing more demand come in because of additional complexity and other things. But I do think that 3 year horizon allows you to think about doing things that we may not have felt comfortable doing before, when we just hadn't had that view as to what was happening in the next year.
Thanks, Emily. Councillor Donnelly, did you want to come in?
Yeah, just briefly. I mean, I think it's absolutely the nub question, because I think from a political standpoint across local government, councils run by all the, shall we say, traditional political parties of local government have been seeking a broader, longer settlement. I think there's been unanimity on that, and I guess now it's going to be kind of put up or shut up for all of us, because either we're going to make something better of it, and then it may be nuanced. I think for some, in the short term, may not be. It's not revolutionary, but it helps us take strategic views. It helps us perhaps encourage us to be braver in making certain types of change. Funnily enough, like your question, just this very day, I was at a seminar with Councillor Newstubb about run by the Health Foundation and CIPFA, both very fine organisations, and it was about prevention primarily in the health sphere. So I mean, much of it, at its worst, talk of prevention is like somebody telling you you'd be better off not getting the bus. You should save up and get a car, when you spend literally all your money on bus fare. So it can sound, I know I would save money, but I have no money to invest to do it. But there was a sense that across the sectors through health, the academic world, bodies like the Health Foundation, and the governments across the nations, as it were, there is now a more focused drive to see what can be done to achieve that, to have to prevent and delay, I think was the key phrase, to prevent and delay, and to for all of us to reap the benefits as individuals, because we live healthier lives for longer, and for society because we have to invest less money in a relatively fruitless way, which doesn't greatly benefit individuals. So I think there's a chance that thinking more strategically, councils, cabinets across London, across the country, will take more strategic approaches.
Thank you, Councillor Donnelly. I don't see any more hands, any more questions for Emily while we're here. No? Okay, well, thank you very much, Emily. Councillor Donnelly, did you want to have any final words? No. Well, thank you both very much for coming. And you've obviously explained, as you always do, very helpfully and very clearly, some complex issues. So thank you very much. So the committee is being asked to note the contents of the report. Are we happy to do so? Thank you. Thank you. So Councillor Donnelly and Emily Hill, you're free to go now. Thank you very much. No work programme, so no, we'll just leave it off completely. Okay. If that's scheduled for a call in, isn't it?
No, that was
a normal
item. Yeah.
Okay, right. Well, thank you very much, everyone, for attending tonight. The next meeting will be on the 4th of December, and I look forward to seeing you all then. Thank you. Bye-bye. Thank you. No, it's a normal one.